Hello and welcome to Down to Earth with Terry Virts, where we talk about what matters down here on planet Earth. If you love the podcast, please subscribe and give us a rating. And today I am super excited to be talking with a good friend of mine, Dr. Ricky Flores. He's the clinical director of the Texas Children's Cancer Center in the Woodlands near Houston, Texas. He is also president of the Correa Family Foundation, a nonprofit set up by Houston Astros shortstop Carlos Correa and his family that focuses on supporting children with cancer. We're going to talk about medicine stuff. We're going to talk about kids. We're going to talk about baseball. And we're going to talk about UFOs and other space questions that Ricky has for me today. So it'll be more of a conversation than an interview. So Ricky, thanks for coming on.
Thank you very much, Terry. I mean, it's a privilege for me for the invitation and being here today with you. And you know, like I really enjoy our conversations together. So I'm glad to have this platform and we can discuss really interesting things today.
Ricky is an amazing human being, and you're just to watch you work with kids when I've had a chance to see that is incredible. Your energy, your positivity is amazing. So before we get started, what's your origin story? Like, can you just talk about where'd you come from? Why'd you get into medicine? Why'd you get into pediatrics? That's a very unique part of medicine. How'd that start?
Well, I'm originally from Puerto Rico, and I was born there and trained there, studied there and trained there. I did my high school, I did college in the University of Puerto Rico. And during my training at the university, I kind of like was leaning towards, I've always, since I was a kid, since I can remember, wherever I felt more comfortable was with physics and math. And I was like learning physics on my spare time. So I always thought that probably I'm gonna go into that field. But in the University of Puerto Rico, I realized that maybe if I went to that field, I wouldn't have the opportunity of dealing with people, interacting with children, which were my passion. I was always like with children during the family meetings. I will try to gravitate to them and play with them. So I ended up deciding to go into med school. And we have an amazing med school, the School of Medicine of the University of Puerto Rico. And I went there. So I decided to go there and not follow my physics passion. But I don't regret it. And then after medical school, I got really good advice from the mentors that I got there. So that's why I've always considered that mentorship is really important, because some of the doctors there, actually Dr. Nidia Bonet, who is an icon there in Puerto Rico in medicine. So she told me, if you're gonna go into pediatrics, make sure that you stay here in Puerto Rico for the pediatric residency, which is a great program. And then for your subspecialty, you can go to the States. And so I follow her advice, and it probably was one of the best decisions that I did, because the training that I got there in the University of Puerto Rico, the School of Medicine, and the hospital was very hands-on. We were working very hard, but learning a lot. And I didn't have an idea of what I wanted to do after becoming a pediatrician. You know, we have the different subspecialties, but during second year of my medical school, my mother-in-law was diagnosed with cancer, with leukemia, and she eventually passed from the disease. But that gave me the opportunity of kind of like seeing cancer as a whole, like from the treatment perspective, from the family perspective, the needs, everything that you need to do. And even though all of us sacrificed a lot and worked really hard, she ended up dying. She was treated in Seattle at Fred Hutchinson Center. So that's when I decided to become a pediatric oncologist. And I was actually, during the residency, then I interviewed in different places. And of all the places, the place that really stole my heart, that I knew right away that I wanted to be part of, was the Texas Children's Cancer Center here, because of, once again, because of the mentors that they had in here, because of the type of the quality of medicine that they practice here. And back then, the director of the program was Dr. David Poplak, who for us is like a legend. He literally wrote the textbook on childhood cancer, and the way he treated us, and how inclusive he was with minorities, and the way that he made me feel more kind of like a paternal feeling rather than just like a work or more professional. So it made me decide to come here to Texas, and that's kind of like the story of how I ended up here in Houston. And I actually was planning to go back to Puerto Rico after finishing my training, but in here there were so many great opportunities for for research. I was recognized by the NIH for some of the research that we were doing, some kind of like state-of-the-art research, because the interesting thing is that what Dr. Poplack recently, I was awarded a philanthropy award by the University of Houston recently, and they surprised me because they brought Dr. Poplack to give the award to me. And what he told me that day is that one of the main reasons we selected you is because you told me that you did physics and general relativity on your spare time. So after that, he told me, but you know what, you can use that interest in going into this omics, new kind of like field that was developing there, of developing high throughput data and bioinformatic analysis and so on. And you can use some of your math interests and so on. And that's exactly what I did for a long time until I became more administrative as clinical director.
Right. Well, I'll tell you, I love physics too. I almost majored in physics and I ended up majoring in math because I did an exchange at the French Air Force Academy and I couldn't do physics, but I think you picked the right career. Physics is a good hobby, but you're a people person. I've seen you in work a lot of different times at the hospital and at charity events, and you're definitely a people person, and the world is a better place because you picked that, I think, over physics.
Thank you so much.
Yeah.
Thank you so much. And you know, it's interesting now talking about physics. You know who was the first person who actually made me feel exactly like you mentioned? It was Neil deGrasse Tyson.
Yeah.
I happened to meet him probably like 14, 13 years ago here in Rice University. He came to give a lecture. And I had this particular question that had been bothering me for a while, physics questions. And so I waited until the end of the lecture and I went to him just to ask him that question. But he asked me like what I did and so on. And when I explained everything to him, I could see his face like lit up, like, wow, you're in medicine, you're in pediatrics, you're in this and that. And I'm like, yeah, the grass is always greener on the other side.
It is, yeah.
You're great where you are right now.
That's true. So you mentioned Houston. I've had several friends in the last couple of weeks come here for cancer treatment. Everybody knows Houston because it's space town, you know, mission controls in Houston. It's energy, it's oil and gas. It's the world's headquarters for energy. There's transportation, the Port of Houston, it's amazing. But the medical facilities here are incredible. I was lucky enough to do some training. I was a crew medical officer on both of my space flights. So I got to work in the hospital downtown, work in the ER. There's a lot of medical facilities here, but probably cancer is what Houston is maybe most well known for. Yeah.
Yeah, and so we have the largest medical center in the world, most likely. And but an interesting thing about Houston, which we started recently exploiting, is the fact that you have all of these great medical institutions like Baylor College of Medicine, Texas Children's Memorial Hospital, MD Anderson Cancer Center, different hospitals and medical institutions. But at the same time, like next door, you have Rice University, also you have the University of Houston, Texas A&M. And for example, there was a program that was built to specifically exploit that junction where they gave grants, and I participated for 2 years in this program, in which you have one person, you have a student or a trainee, and you have one mentor from biology, from cancer, and one mentor from computational informatics and computational department. And then you get them together to come up with new theories and new ways of looking at cancer or whatever biological problem you're analyzing. And that's something that's very particular in Houston.
So if I want to talk about physics and relativity and UFOs and stuff like that, but there's parents listening right now. And so, you know, what kind of things, and parents worry about kids. When you have young kids, you have irrational worries and, oh, is this a problem? Or, you know, it's just something that parents worry about. So as a doctor who treats really serious problems, like, do you have any advice? Are there certain things to look out for? When should they go see a doctor or not? I know that's a really broad question for lots of things, but, you know.
Well, I think that we can definitely start by defining cancer and the problem that we have with pediatric cancer itself and oncology, which is, so most people don't know, but cancer itself causes more death than any of the other diseases combined. So
for kids or for adults or for everybody?
For kids, for children.
For kids, yeah.
Younger than 19 years old is going to cause more death than any of the other diseases combined. And so every year, so 2022, we're probably going to diagnose 17,000 new children with cancer. Okay, so that's one every 30 minutes.
In the US?
In the US.
Yeah.
In the world, that's probably more, 370,000 or so on. So in the world, it will be every 90 seconds, someone will get diagnosed with cancer. And keeping in mind that in the world globally, is probably underdiagnosed because many different countries are not going to be diagnosed.
They don't have Texas Children's in most places.
Exactly.
Yeah.
And that is something actually that we're trying to solve. For example, Dr. David Poplak, who I talked briefly a few minutes ago, that he transitioned to this global HOPE standing for Hematology Oncology Pediatric Excellence Program that we have with Texas Children's. And what they're doing is they have this setup in which they're trying to create an environment in which they can treat pediatric cancer patients in sub-Saharan Africa. There's 7 countries in there, because in those developing countries, the survival rate of children with cancer is 20%. So here in the United States, we were able to get it up to 85%. But it's like we said, in this field, we're not gonna be at peace, or we're not gonna start working hard until we'll reach the 100%.
Right.
So you can imagine back before the 70s, the survival chances for a patient with cancer, pediatric cancer, was like 10%, 20%, was very, very low.
In America.
In America. So
wow. So you've gone from 10 to 80% survival.
Yeah, in a few decades.
Wow.
But so what happened was, interestingly, so World War II came, right? And they started to use this chemical warfare, and you had they had used in World War I, and they were not supposed to use it in the Second War, but they did, and it was the mustard gas. Mm-hmm. So the U.S. Army and the United States, actually the Department of Defense, were thinking about it, and they knew that was going to happen. So they set up like these 2 pharmacies to kind of like to work on it and study the problem and try to develop some agents that could counteract the mustard gas. Mm-hmm. And they realized that was very volatile, that substance in the lab. So they substituted one of the sulfur atoms with nitrogen to make it more. So they created the nitrogen mustard. So once they created that, then there was an attack in Italy, I think, and 1,000 of the soldiers were exposed to mustard gas. Mm-hmm. And they analyzed, and on the autopsies, they realized that the bone marrow, which is the factory of all of our cells in the blood that rapidly divide, were dead. So they said like maybe this type of agent may be helpful to attack cancer, which they knew that was basically cells rapidly dividing.
Right.
So that's the first time that it was proposed, and they ended up using, but this is 1940s, 1950s, they ended up using in one patient with lymphoma, which is cancer of the lymph nodes, and they saw some response. So after that, Sidney Farber, this doctor in Massachusetts, was the first one who we knew that there were some folic acid analogs. So folic acid is a vitamin that we have in the body that is very necessary and needed for the survival of the cells. So they used some compounds that were similar to that one, but not exactly the same. So it will displace the actual folic acid, and then the cell will not be able to function normally and die. So he used some of those analogs for the first time in children with cancer, with leukemia, in 1948. So that's the first time that actually someone, and this was not by chance, he did it, it was kind of like designed that way. So he used it, and he saw some remission, some response in the kid with leukemia.
Right.
Okay, but back then, the thought was that leukemia was incurable, that you should let the kids die in peace. So it took some time for that to kind of like kick in. And then probably by 1950s is the first time that we started using that leukemia, solid tumors, and we saw the first responses.
Wow, and that came from chemical warfare agents.
Interesting.
The research from that. Wow.
Yeah, that's ironic. And 1947, I know that you're gonna like this fact. One of the first adults to get chemotherapy agents like that, you know who was? Babe Ruth.
Oh, wow.
Yeah, you know that he had nasopharyngeal cancer. He died the next year, but he had some response to some of these agents. But
was that the first chemo? Is that chemo, and was that the first?
Yeah, so those agents are called chemotherapy, which is kind of like any other medication, but it's what we call cytotoxic. that what it does, it kills it, it interacts with the DNA, and it doesn't allow the cells to replicate. But when you think about it, if you have your body, there are all of these cells are replicating all the time, most of the time, but they replicate at different rates. The cancer cells replicate really fast, and because they're focused on that, they also have a harder time kind of like recovering from DNA damage. So when you give chemotherapy, you affect all the cells in the body, especially those that want to that replicate really quickly. So that's why you have side effects. But the most of the brunt of the effect are experienced by the cancer cell, the tumor cells. Okay, but that's bring to points. Then we need that it works, but at the same time, because of the side effects, we continue to work on newer agents with less side effects.
Yeah, you're giving the patients mustard gas. I mean, that sounds pretty rough, you know, but it's better than the alternative, I guess. So back to, you know, I guess leukemia is obviously a big problem in the children's cancer world. What kind of things can and again, I don't want to alarm parents because there's tens of millions of kids and there's 17,000 cases. So it's not like, you know, every problem is not going to be cancer. So we don't want to alarm them too much, but what kinds of things can they look out for if they have a child that's sick?
Like you said, one of the issues that parents and pediatricians in general, or community practice physicians, is that for example, leukemia is the most common cancer in children, but it can imitate many of the other diseases and illness. And so, for example, it can present with you notice that your kid is more pale than usual, more tired, maybe bone pain, limping. Limping is a red flag. Anytime that your kid starts limping out of the blue is something that you really need to look into. Headache and recurrent fevers that just don't go away. And that's one of the problems. You know, usually the kids pre-pandemic got about, like on average, about 14 regular viral infections a year, and each infection may take like 10 to 14 days to fully recover, and they seem to overlap. And sometimes you talk to the parents and they're like, my kid is always sick. But that's different. You know, when you talk about fever, pain, and the patient doesn't act themselves. And I always tell the parents that the person that knows the best their children are the parents. So we will always pay attention. So if you go, like, they get antibiotics, they don't get better, they start developing like weird symptoms like that, mostly like what I mentioned of like bruising, easy bruising, any type of bleeding, pain, and not acting themselves, that's kind of like a red flag that something else may be going on. So that's at that point, I think that probably parents may have to be a little bit more pushy if their primary pediatrician is not doing additional testing, just to make sure that they at least rule out kind of like severe or more serious illnesses.
Is it, and I'm sure this is true, but it's better to catch things sooner than later, right? Especially if it's cancer.
Well, yes and no. So with and that's one of the misconceptions too, because in adults, you know, we do screening and we do all of these tests to be able to detect cancer early, because cancer in adults and cancer in children probably are kind of like two different entities, even though it's the same diagnosis. So in children, it seems to be kind of like we call it a mistake in nature, because of random mutations and so on during the development. It can start in utero actually and express itself later when they're a little bit older. So because of that, what we find is, of course, is good to detect things early, because you don't want them, like, for example, if you have leukemia, your immune system is going to be low. So during that time, you're at risk of infections and so on. But once you are, let's say you are in the hospital and you're undergoing diagnostic workup, and we know that if you have some type of cancer, but everything's controlled, we're controlling for the side effects, possible complications, then we rather wait until we have a definitive diagnosis and how we're gonna treat it, rather than rushing. Because if you discover the cancer, let's say 2 weeks later or 2 months later, 2 months earlier, probably in the final survival or the final outcome may not change that much. So that's one of the things that we tell the parents too, because let's say that your kid has a mass in the, had a trauma, has a mass in the femur or the thigh area, and you think that it was because he was playing football or whatever, and he hit himself in that area. So you keep waiting, you keep giving some medications to see if it goes down, and then like a month have passed and it kind of like is growing. So you take them to the pediatrician, and then they do some imaging and they realize that there's a tumor there. So at that point, all parents are like, what would have happened if I brought him as soon as I saw it, or so on. And we kind of like try to make them at ease, telling them that's probably not gonna make a huge difference once we diagnose it.
Right. And do you do surgery? Or I know you treat leukemia, or is that a special surgery is a specialty, I guess, right?
Yeah, it's a different specialty. We do procedures, like for example, we do, so in kids and children, for example, in leukemia, there's different organs, especially the central nervous system and the testicles, that are protected from the everything that we have in the blood. So the barrier there is harder to pass. So whenever we give chemotherapy through the vein, it doesn't actually access easily those organs and those compartments in the body. So for that reason, we give chemotherapy right into the central nervous system space. So we do that. Is like a lumbar puncture, and we do that type of procedure. The other thing that we do is we do biopsies and aspiration of the bone marrow. You know that the bone is hard on the outside, but on the inside is soft, like chicken bone. So we go with a needle there and we aspirate, and we're able to look right there at the bone marrow on the microscope and do other type of tests. So that's the type of procedures that we do, but we're not surgeons per se.
This podcast is sponsored by Book Arts, the world's premier creators of unique books that are truly works of art. To see an example of one of their beautiful creations, a limited edition reproduction of the Apollo 11 flight plan, visit www.apolloflightplan.com. Right. So there's even within the child oncology universe, there's different specialists who do different things with the procedures. Well, I think that's just important to know, parents, you can be at ease. It's probably not cancer, but if it is, and you're having these symptoms, go get them checked out, and maybe be forceful with your pediatrician, because a lot of pediatricians are not going to necessarily promote the test that they need right away. So the parents can take the lead.
Especially if you know that there's something different with your child. If I meet a child for the first time and he's very quiet there, sitting and not moving much, no other complaints, I may not notice that that's something very different until the mother tells me that he's usually all around walking like crazy, and he has been like worsening, getting more and more fatigued,
lethargic. So tell us a good story. I know you have some really cool stories, and you bring kids out to Astros games. And so what's a good child oncology story? And I know you have a lot.
Well, I have two great stories with you, actually, that I love and I tell everyone. The first one is that I had this child who I was in at the hospital, and I needed to discharge him. And the only reason keeping him in the hospital was that he was not eating. And I told him, man, you have to eat, and then you're gonna go home. And I saw something about space that he was playing with astronauts or whatnot. So I told him, let me call one of my friends, and then I FaceTime you. You were at a golf course, so I really thank you so much for taking time from your leisure time. And right away you told him, like, what's going on? I'm like, he doesn't want to eat. And then I showed you what he had in front of him, which was like some chicken tacos. And you told him, well, that's better than anything I ever ate in space. And then he's like, okay, I'm going to eat it. So he ate that. And the other one, actually, you were visiting a patient with me at the hospital, and you brought your book and with the pictures, and he was like so excited about it. And he started like looking at the pictures, and then he saw one, and he was like, oh yeah, I think I recognize this planet. And we were like, yeah, we all do. He's like, it's Venus. And you're like, no, actually it's planet Earth. And he's like, no, I've seen Venus before. It really looks like Venus. And I told him, well, it was from space, and it was Terry who took the picture, and Venus is really far. So I think I will pay attention to Terry. And then he's like, okay, but then when we were leaving, he's like, I think it's Venus. It reminds me, but Galileo, Galileo, that story that when he was in front of the Inquisition saying that, yeah, sure, the Earth is the center of the universe, or whatever they wanted
Right.
him to say. And then as he was leaving, he was like, "Eppur si move," and yet it moves. That's the legend that he said, that it doesn't matter what I say, it's still like the sun is the center of the solar system.
Right.
Yeah, people say that he may not have said that because it could have cost him his life.
Right.
But anyway, but I felt that the kid felt like that. It's like, as we were leaving, he's like, it's Venus.
He was a cool kid. I remember the thing that stuck out about that boy. Well, first of all, he doesn't have hair. They're tired, bloated. You see these kids and your hearts go out to them because they should be running on the jungle gym and playing baseball and whatever. But he was just a really super smart kid. He knew all this stuff about astronomy, and his mom was there, and they, these poor folks have to travel a long way. Not everybody has a lot of money that's not a problem. It's a burden on the family. The parents work, except for that you can't work if you've got to be with your kids for weeks or months in the hospital. And so there's just so many hardships. It's not just the kid, it's the whole family. And, dealing with cancer is just tough on a lot of different things. And there's different charities, there's different ways you can help. But I think that's just something good for folks to know and have some empathy for the folks that have to go through this. Because, one day it's going to be me too. So,
and what you said is completely right. People don't realize that cancer, the economic and emotional burden of cancer is huge. And
right.
It affects the whole family, okay, if not the whole community. And that's why, for example, when Carlos Correa and his family, like, he asked me that to go and visit some patients. He really wanted to help. It came out of him after we had been doing some humanitarian efforts with the city of Houston in Puerto Rico after Maria hurricane in 2017.
Right.
and it's to me, it's interesting because now at my age, I can see them. He's like a brother to me, but at the same time, I'm kind of like older. I have more experience, so I feel really proud to see these kids, we call them kids, the players and so on, come to the hospital and be able to enjoy and learn and change. So the first time that Carlos and Daniela came to the hospital, they say it everywhere they go. It's like they went with the mindset of like, we want to change these children's lives. And when they got out of the hospital, they were like, oh, they changed our lives forever.
Right.
In fact, you have experienced that with me. Whenever I take these patients to the games, I love it because the Astros Foundation and the Astros organization have been very helpful with that too. But whenever we go there, the patients cherish that experience so much, but at the same time, the players too. So I call them beforehand. They know that I'm going, everyone, the families, and you've seen it. You've been there with me.
Yeah.
Not only the players, but the families also. And to me, that's kind of like priceless. So many people always ask us the question that we get is, how can we do it? and it's like, there's nothing else that I will be doing. Like you experience that type of thing once in your life, and then you're done. It's like, what's the right decision?
It's awesome. We've met it. We've done a bunch of these different charity events, but it's Daniela also. It's not just Carlos who support this. And at the events that I've been at, it's a lot of the Hispanic players on the Astros. So guys from Venezuela or Dominican or, Jose and Martin and all the different guys. They're all good friends and they support each other, and all their wives are good friends. And they're really, trying to help this cancer charity out. And the Astros themselves, like you said, they have done a lot to bring these kids, cancer survivors. There was a teenager who was great. I think he was fine. I mean, kids can get through, they can just get healed and live normal lives. This guy was like, you treated him when he was a little kid, and he's a 20-year-old now.
And there's Ethan Hughes. You actually met Ethan, and he just recently rang the bell. That's our signal when you finish all chemotherapy or all therapy. And this guy is amazing. You guys with charisma. He rides their bikes. He's like overall he's a champion.
Right.
One example of like all of these amazing stories, because of course there's sad stories, but like I said, 85% of our children get cured. You know, and many of my colleagues, actually, we have a provider. You actually met him, Dr. Michael Gleason, and he's a survivor. and he's one of the best doctors that we have. You know, if you go through cancer and you have that background, you're able to treat your patients differently. We have one of our nurses that you've met a few times too. She lost her daughter to cancer, and what did she do after that? She decided to become a nurse and help us. I have and you met one of my other patients, girl Jessica, and she's a 20-year-old now. And I treated her. I started treating her when she was 12 years old.
Yeah.
She almost lost her leg, but we were able to get through. And now she recently started working at the hospital. So we have these amazing stories, and being able through the years to grow with them, like I said, and become more mature as a person with them. That's, to me, is priceless.
It is. And you know, if you almost lose your life, it's like you have a new lease on life. And I get a feeling from some of these survivors that they just have a much better attitude about life than, you know, if you never had to face this problem, especially at a young age. It's such a, you know, a thing. It gives you a better perspective to not get so upset about trivial things, you know, and not spend all your time getting mad from what Facebook tells you to get mad at.
Exactly, especially teenagers now. It's a different generation for sure, and everything that they're exposed, and the bullying and all the cyber stuff that is going on. I cannot imagine the stress that they're under that we were not exposed to. But you know that as a teenager during those age, you feel invincible, and then like having your life just like shocked like that. So actually what I do with my daughters, with my nieces and nephews, I try to bring them to my events. I try to bring them to the hospital as much as possible. I'm not telling anything. So just that they are exposed to that and they see kids their age going through what they're going. And I think it definitely changes their perspective. And this is something that the players mention a lot. Like you mentioned, you know what I really love, and people may not know from outside, but especially me coming from Puerto Rico, the Hispanic community, we're like a family, you know, like for Carlos is like a brother to me, but you have Martin Maldonado, you have Jose Altuve and his family, and I'm mentioning them, but this includes their children. You've seen me with their children. You have Julie. You have Jordan Alvarez, and they're all young kids, right? You have
Jordan is a young kid, yeah.
Alex in front is my age, and he's a coach, but Jordan is a kid, and just being able to help him to some extent, kind of like with his children, and kind of like giving my perspective in life and different things, so they know what to do. And like I said, these are the guys. Like for example, Maldi Machete, sometimes like he have called me like late night. I just saw this case that we help this kid. He calls me for magic tricks also. Hey, I just saw this magic trick video. What do you think of it? But if he sees like a case that is important or interesting, he calls me to see how we can help. And that's the type of thing that people don't see from outside. But these are just like kids, like, you know, 21, 22, 23. You're developing.
Yeah, of course. Of course. No, it's a very cool community. And the one thing, like I said before, I noticed about you is your empathy, and you're a people person. I think there's different kinds of doctors. I'm learning about this as my own kids are going to medical school and so on. You know, the pediatricians are really need to have good bedside manner. The surgeons are like not necessarily as good bedside manner. And I'm sure you have lots of jokes when you go to different residencies about personality types. But you are dealing with parents of little kids. The parents very likely are not highly educated in medicine. Most of us are not. They may not have the right economic status. They may not even speak English. And Houston, I think, has the biggest community of Vietnamese people outside of Vietnam, right? It's a super diverse city, lots of Hispanics. And so with all of those things going on, your ability to, you know, connect with the parents and kids is, I've never seen anything like it, Ricky. It was really impressive.
Oh, thank you very much. I really feel privileged from those comments, and especially coming from you, that you know that I appreciate you a lot. And likewise, I know that people have told you too, but I've met different astronauts and different professionals and so on. But having the passion that you have, and every time that and I can be very annoying with my questions and stuff, but and even like the patients, I still remember one of our patients when he asked you about space and all the effort that you put into answering, like if it was the first time that you got that question, I think kind of sets you apart from the rest.
Well,
And I
thanks.
remember like when Ethan asked you about space, is that you're like really into it, describing like the G-forces from a jet, from the difference from the shuttle and so on, how amazing it is. And after you were done describing the G-forces and sometimes the techniques that you have to use not to pass out, then I interrupted to say that I have been to Space Mountain. And you were so nice that you let it go. And you're like, yeah, like, I think that's like 3 Gs of force.
Space Mountain is cool. I as a kid and as an adult with kids, I would ride it and then get back in line and then ride it and get back in line at Disney World. That's funny. So let's talk about space and physics stuff. But before we get there, I'm going to just mention COVID briefly. Because when I went to the hospital recently, COVID was a big thing. It was sealed off. So how is that going for kids? And can you talk about the vaccine? There's so much misinformation and there's some really important things to know. So how is it? Are you getting flooded with children's COVID cases? And what should parents of children be doing as far as COVID goes?
Well, definitely we're seeing an increased number of cases that has been across the board. There's no denial on that. Now, thankfully, like our children tend to do better with COVID than when you compare it to adults, but we have a lot of children that have comorbidities. Let's say like if you're getting chemotherapy, if you have asthma, if you're taking some immunosuppressive medication, some medication that decreases your immune system. So then you are at higher risk of complications. But I think the most important thing to understand here, and okay, let's put COVID aside because this is something that I've been struggling for years to get to people to understand. So there's no medical intervention. There's nothing that I can think of in medicine or any discovery that has had more impact in decreasing death, disability, and disease than vaccines. Okay. The problem with that, and I know that with your type of profession, everything that you do to prevent issues or accidents or tragedy, you don't see those, right? Or those are more imperceptible. You cannot perceive it very well because let's say that in medicine, if I have an injury to my arm and then have to undergo this very complicated surgery that is only done in one state within the United States, and that kind of like help me decrease my morbidity or my disability, then I will see that like, oh my gosh, these people are heroes, or that procedure is the best. But when you look at vaccines, probably all the vaccines that I got earlier, like polio, smallpox, and everything, varicella and whatnot, as a child, it probably saved my life multiple times. Right. So vaccines save millions of lives every year, right, globally. And that's something that we don't perceive, or it's really hard to understand because it's not as active, it's preventive. Right. So now, having said that, the COVID vaccine have saved millions of lives already. But the other issues is that the main issue that we have is that globally speaking, we're not gonna get out of this problem until close to 100% of the people in the world are vaccinated. Right. So now we're at 20%. So there's a long way to go. Like right. Texas Children's Hospital and Baylor College of Medicine recently got the emergency use authorization for their world COVID-19 vaccine to be used in India. So hopefully they can do that. They develop a new type of technology using protein that is more stable and it doesn't need to be kept as cold, and it can be mass produced at a lower cost. So they're going to start in India and hopefully go to other underserved countries after that. But I think that's the light at the end of the tunnel. But from our perspective and from parents and children, you definitely need to protect them and just like get the vaccine. That's the only thing I need to say.
I think it's frankly misinformation. There was a big scandal right now going on about Joe Rogan. Myocarditis is something that a lot of the anti-vax community will talk about. And I don't know what that is. Can you talk about what that is, what normal risks of myocarditis is, what the risks when you get COVID is, and what the risks when you get the vaccine is, what the risk is? Yeah.
Sure. Without going into details about the risk, you can, there was some cases of myocarditis, which is basically an inflammation of the heart. And that you can see that with different different diseases, illnesses, viruses, and so on. So like large scale, there were a few cases that were seen that of patients that got myocarditis compared to placebo that were a little bit higher. So we assume that may have been caused by the vaccine. But what happened is, like, of all of those cases, none of them were fatal, and people were discharged from the hospital. The patients were discharged from the hospital. But on the other side, if you don't get vaccinated, we know for sure that you can get many more complications of the heart, of clots, of lungs that are much more higher than the myocarditis.
Right.
So let's say, for example, this is, in medicine, you always weigh risk versus benefits. It's like we were talking, I give chemotherapy to my patients, which is basically kind of like poison, and they're gonna have side effects, but the benefits outweigh that.
Right.
So that's what we're seeing with the COVID vaccine. So I know that there's so much misinformation, but at the beginning, I understand that there was some room for discussion because there was not the data. We didn't have the data that we have right now. But there's so much data now, not coming from me, just like from experts and peer review data. That it's out of the discussion right now. It's like if you're not convinced at this moment, we can educate, but if you don't get convinced, it's probably you're not going to be convinced any other way. If there's no discussion right now, it's the end of the discussion. We have enough data to know that it's safe, and that is the most effective way of getting rid of this.
I like the way you put that. In the beginning, there were questions. It was a new disease. It was a new vaccine. But at this point, a year into the vaccine, hundreds of millions of people have gotten the vaccine. Problems from the vaccine are exceedingly small. Problems from COVID are exceedingly large. And the only way to get rid of the pandemic is to get vaccinated. And people who choose not to get vaccinated going forward are actually putting all of the rest of us at risk because we have to pay for their hospitalization, and that's expensive. They're actually causing other people to pay for their sickness, and they're going to transmit the vaccine and maybe get some of these kids who are having chemo. They're at risk. You're actually putting other people at risk when you don't get vaccinated and when you don't wear a mask when you're in a group inside, I think.
Yeah, I completely agree. And this applies, so the way you put it is perfect. And this applies not only to COVID, for example, flu vaccine and different other vaccines. Like I said, once again, it's really hard to understand the fact that many of us are probably not paralyzed just because we got the polio vaccine as children. We don't see that anymore, right? Like smallpox. And even like varicella, it can cause like brain issues. It can have devastating effects on children and people, and we don't see those.
I've had kids. You deal with kids all the time. Kids in America are healthy. They live great lives. There are some problems, and you treat them, but very few. And it's because of vaccines. Like, you could go back to the 1950s. We could go back to that wonderful time in American history, the 1950s. Kids died a lot, right? Like, cancer was not survivable, leukemia, polio, all these things. So I really hope we can kind of get over this national, I don't know what it is about medicine and science and vaccines, and hopefully get through this, because it saves lives, and it saves not just lives, but also like getting sick and hospitalization and
And I think education, the problem now with and I think you've mentioned it before too, you can go down a rabbit hole, especially with social media and the new algorithms, and how depending on your view or the information that you get, then probably you're gonna get bombarded from different sources.
Yeah, that's a real problem.
Like, is it reliable or not? And peer review publications are probably the strongest tool that we have right now, and the most objective one to push forward. Because if you let that misinformation guide you, it's gonna be like a really hard time. And we don't judge anyone, and I know that many of these parents and people, I think they have the best interest in mind. They want to protect their own and so on, so they think that they're making the right decision. But at this stage, like we said, we have enough data to know that it's safe, and that is the best way to go.
Exactly. Well, I want to talk about the Carlos Family Foundation again. So Carlos and Daniela were impacted when they went to the hospital. they did some work in Puerto Rico after the hurricane. And what does that organization do? Tell us about that, because there's really cool things that they do.
So initially it was interesting because, we got Harvey here when they won the World Series. And I happened to know Carlos and his family, and Carlos Correa and Carlos Beltran, who was here that year too.
Yeah.
And
he was our DH.
Yes. So with the Correa family, we used to do kind of like help people, just do stuff on the side behind the scenes. Every time that we saw a need, we would like to try to get together and volunteer and do stuff like that, but no one knew about it. And Carlos had an interest there. They were really busy with the season and the playoffs, but he had told me that I really want to go to the hospital and visit patients. And but then after the World Series in Maria hits Puerto Rico, and is the impact that it had in the island is, I cannot describe it. Like in the blink of an eye, they went back like 150 years.
Right.
So and that's when I realized the big heart that we have in Texas. So we got together with some professionals that we have in Texas. I have friends like Dr. Mario Polo, Javier Ferrer, Marian Cabanillas. Like these were people, physicians and professionals that I knew here from our circle. And we got together and we kept growing. And then we kept asking the Texas community to help us with Puerto Rico. And the response was incredible. Like to the point where then all of a sudden we have thousands and thousands of pounds of supplies and donations to send to Puerto Rico. And that's when we realized, like, we're not going to be able to.
How do you get them there? How do you get them there? Yeah. Yeah.
So right away, they were in the middle of the playoffs, the Astros, but I texted Carlos Beltran and Correa, and I told them, can we get a private plane or something?
Right.
And then Beltran replied right away, Ricky, I donated $1 million from my own money, and we're securing some transportation, and we're gonna meet with Jim Crane. So all of that, fast forward,
I'm sorry. Okay, Carlos Beltran donated $1 million of his own money.
Yes, for the efforts in Puerto Rico.
Okay, so I just want to say that out loud. Okay.
Yes. And then we started working with, there's the NACC, National Association for Christian Churches Disaster Services here in Houston. And they work closely with Jim Crane too. So we started working together and we were able
Jim Crane is the owner of the Astros.
Exactly. So we started transporting a lot of stuff, and Crane Logistics too. He's the CEO of Crane Logistics. So they work a lot with transportation. So that's why Jim is able to help us with all of these airports.
He owns the Astros because he owns Crane Logistics. Exactly. Yes. Exactly.
But so at that time, then it kept growing to the point. So at that point, we're all about helping. So we just I kind of like got help at the hospital. My family had to sacrifice a lot, but all of these professionals, these volunteers, and all of us just like founded what was called the Texas United for Puerto Rico, and then we started sending stuff to Puerto Rico. And we got together with Sylvester Turner, the mayor of Houston, and they talked to United Airlines. And at that point, what they did is they donated a 777 to fly to Puerto Rico. And it was the best experience that I've had, because then it was only a few of us, a few congressmen and women, and our team. There was Shakira Cruz, she's a lawyer, and she's the daughter of Jose Cruz.
Oh, wow. Yeah.
Legend here from Houston.
Yeah.
And it was a handful of us flying on an empty plane, so we could have more space and more
cargo.
More cargo.
Yeah.
So we transported 50,000 pounds of cargo to Puerto Rico.
Wow.
Right? So we got there, and this is interesting too. Like at some point, I looked at one of my friends, and we had a teacher coming with us from a elementary school. And he had a bag of letters, and my friend is reading the letters, and she starts crying. I'm like, "Is everything okay?" And she's like, "No, Ricky, you have to read this." And when I read it, it was like 3rd grade, 4th grade kids writing in Spanish. It gets me emotional.
Yeah.
In broken Spanish, about saying that to the people of Puerto Rico, to the children, we understand what you're going through. We just went through Harvey. And because in the kids' minds, like hurricanes, earthquakes, and everything is like that, it doesn't only exist in the movies. But Houstonian children went through that, And when the teacher asked them, do you want to send a message to Puerto Rican children? And it was so beautiful, the way that they expressed what they lived through, and kind of like supporting the Puerto Rican children, telling them, if we got through that, you're going to be able to do that because you're really strong. So I got that to the Department of Education to Puerto Rico. But once we got there, the problem was like, and it always reminded us of Roberto Clemente, who's our icon from Puerto Rico. And he actually died at the same age that I had when I was traveling to Puerto Rico, doing the same thing, that you had to go and make sure that the cargo got to the people so it didn't get stolen by different.
Right.
So we got there, and the vice president of the United States was visiting the same day at a different plane, but they were going to close the whole airport. So they told us, okay, you have 50 pallets, I think was the final number, and you have to move it in 3 hours. So you can imagine, and we only had one.
A pallet's a big thing. Yeah.
Yeah, a pallet is a big thing, about 2,000 pounds.
Yeah.
And there were only a few of us, but then we had contacted through our contacts the different communities in Puerto Rico, and everyone came together and they helped us. So they were helping each other, and we were able to move that in 3 hours really quickly. And then some of the other team left the island, and we stayed there a little bit longer trying to help right where Carlos Correa's family is, and bringing food to people that were completely disconnected. They didn't even know what was going on because they have no way of communicating. So just fast forward, we were able to transport 30 patients back to Houston because they couldn't get care there.
Oh, wow.
On different private planes.
Right.
And we transported about 200,000 pounds of supplies, $2 million in chemotherapy. And once we started doing that, that's kind of like what the seed of like, we really need to continue helping. And Carlos realized the impact that he can have using his platform as a professional athlete. And then after that, then we transition more into what our real passion, which is children with cancer, and supporting children with cancer with experiences, money for daily expenses, and so on. But every now and then we get sidetracked with natural disaster like earthquakes in Puerto Rico, some Central American issues, the freeze in here in Houston. Altuve joined us, and we donated so many meals to children. And now the COVID pandemic, with the COVID pandemic, we did the same thing. We have we use our leverage. I'm really glad to be friends with a lot of people involved in the entertainment business from the Hispanic community, urban music, especially from Puerto Rico. And they have such a great, huge leverage now because Hispanic and urban music right now is at the top probably in the United States and many parts of the world. So we use that to create this campaign in which we ended up delivering over 3.5 million of supplies to Puerto Rico, Central America, and Houston during the pandemic.
That's amazing. So are there charities that people can support, or is this just supported by the players themselves, or are there?
Well, from after the Maria, then we founded our Correa Family Foundation, which many of the players actually support to help us during these efforts. And anyone can go to our website or follow us on Instagram and then see what we're doing. But there's of course the Astros Foundation, and there are many other foundations. I don't want to kind of like promote one over the other because together, but at least our efforts have been with the NACC Disaster Services, Correa Family Foundation, and Astros Foundation, which are all here locally in Houston.
That's amazing. There's been, between Harvey and Maria, and there's been a lot of hurricanes in recent years, unfortunately. And Harvey, the flooding was incredible. So many homes were destroyed by flooding. If you don't live in a hurricane area, flooding is bad. Fire is probably the worst because that just destroys everything, but flooding is right up there. It's a really bad part of the hurricane. And so anyway, well, thank you for doing all that. Before we end, I want to give you a chance you had some questions for me.
Oh, yeah, no, the best part. Okay. So first of all, as an astronaut, how much do you need to know about, I guess you can fly a plane without knowing the Bernoulli principle, or how actually the
physics,
details of it, right?
But as an astronaut, how much are you required to know about, let's not talk about gravity as a force, but as
special and general relativity?
Yeah. So it's funny you asked that. I've got my How to Astronaut book for those watching on YouTube. And I wrote a chapter about time travel and how I time traveled when I was in space, because there's this thing called relativity, and they're special and general. And special, I think, is the acceleration, which is also the same thing as gravity, and general is velocity. But the bottom line is, if you go really fast or you have a lot of acceleration relative to somebody else, time slows down for you. So when I was in space, the rocket accelerated and I was going really fast compared to people on Earth. And the NASA physicists, when I was done, they told me that I aged 7 milliseconds less than everybody on Earth. So I actually,
You know what?
my body, and that's real. That's not like some
No,
theoretical
yeah,
thing. I'm actually 7 milliseconds younger than I would have been had I stayed on Earth.
So, so this is, I did my calculation. Okay. So I know
Okay.
that Scott Kelly, right? And
Yeah.
his brother. So Scott was in space for 12 months, was it? Or like a year? Right?
300 and some days. Yeah, I was with him. Scott and I was the commander when he showed up. Yeah.
Because time dilation for him was like 7 milliseconds too, right? And so I'm
something
guessing,
like that. Yeah.
Yeah. So I'm like, well, if Terry was a little bit shorter, maybe his was 3 milliseconds. So the real question, so you go into space, you do all of this stuff, you spend 7 months out there. So how do you feel when you come down and you realize that you have traveled 7 milliseconds into the future?
Well, the main feeling is dizzy and heavy. I mean, you're pretty dizzy, to say the least, when you get back from space. I recovered really quickly. Actually, a week later, they do this balance test, NASA does. And a week after I landed, my balance score was better than it was before I launched. So I recovered from that really quickly. But I think the bigger impact, besides the physical, is the emotional. Having seen that for, I've got the pictures of Earth behind me. And I think it's just, I'm a lot less black and white, and when I was younger, I was a black and white kind of guy. This is right, that's wrong. And I see things in a lot more shades of gray, I guess, if you will.
So I'm so glad that you brought this up, because it reminded me of kind of like a personal question, but I don't want it to sound too philosophical. First, for special and general relativity, there's an interesting point that, so the higher you are from Earth, time will run faster, right? Mm-hmm. Because of general relativity. But because you're going so fast, then it runs slower. So right. What you're describing, the 7 milliseconds that you experience, actually, like the difference between those two effects acting together. Right.
But time sped up because gravity was less, but it slowed down because my speed was more. But I accelerated during launch and landing, so there was a little bit of time. So there's like some speed it up, some slow it down. But exactly. Yeah.
So now from that mental aspect, so I think that I almost never talk about this, but the few times that I've talked to people, I think people experience these similar things, but on different ways, depending on their background, on their interest. But sometimes if I'm really into like learning about the physics, astronomy, and so on, and looking at the world, it is almost impossible to start delving into physics and our natural philosophy without realizing how, I don't want to say insignificant, but how small we are relative to the universe. Okay, so sometimes when I'm waking up, and I think that you don't have all of those, like your neural network is not fully formed on your personality and everything that you're gonna go being during the day. And I think that at that point, when my inhibitions are low, I think more about that. And sometimes it's kind of like a bit depressing to some extent, depending on how you see it, where you're like, you realize, wow, like I'm gonna go wake up, do this, do that, and kind of like get involved in the daily activities. But at the end of the day, we're like this, like Carl Sagan will say, like this blue dot, in space. So, but it doesn't, when I wake up and I'm like with my day, I never have that type of feelings anymore. But if I start thinking hard about it, it's like, it's impossible not to feel that sense of wonder or kind of like frame of reference or perspective that you're like, we feel so great as a human race. But when you take everything into consideration, we're so small. But now from astronauts, you have that perspective and you took those brain pictures, those brain images looking at the Earth. And I know that you sometimes just stare at it, trying to memorize it and to save that moment forever. So what do you ever get that feeling where, not trying to be poetic, yeah, you can see everything like a miracle or that nothing is, but just like deep down, do you get emotional when you think about this stuff or not?
You know what it does for me? It gives me, don't get too mad and upset about things. Don't get too excited about things. It's a steadying influence. I remember looking at the Earth this one day, and I was like, man, that planet's been around for a long time, and it's going to be around for a long time. And so the cares and the problems that we have are probably not as, in the big scheme of the universe, it's just not that big of a deal. Like even climate change, and we need to work to fix climate change, is going to go away within a few centuries. Like we're not making any more dinosaurs. That's not forever. The crazy political things happening in America is not going to last forever. Just when you see the planet, it's like, man, we need, I think it helps you a lot if you can have that bigger picture that the universe is a much, it's a different time scale to worry about.
Okay, that's great. And do you think a lot about the universe itself? I know that you've mentioned in the past about like the different time frames and so on, which kind of like anything anyone's mind about like our perspective of time, which is actually something like, I think I've mentioned it to you before. One of the problems that I have with education, I think that it should be more hands-on and kind of like encourage students to figure out things by themselves. Like for example, when I started studying biology in the University of Puerto Rico, I had this great professor who actually, instead of like, when we were studying Mendel and the genes, how he discovered like these different laws, she gave us the data first. And she said, like, try to figure out you first, and then after that, then they tell you what he did.
Right.
And I think with physics, to me, there's so much misunderstanding, and I have two theories in my mind that everyone should know about, at least on general terms, which is especially with the ones that we were talking about, relativity. That time is not absolute, which is incredible. We never experienced that because of the low velocities that we experience and the low gravitational fields. And the other one is evolution, about natural selection, and how these things are selected randomly. And we have this beautiful thing that we call life, and that's mind-blowing.
It's incredible.
I was talking to a professor, and he told me you need to add quantum mechanics into that picture. And I think so, but no, how do you start even explaining quantum mechanics?
When I was in physics class in college, I remember we're learning about relativity, and I'm like, I sat down and I took a Saturday and I just thought about relativity, and I thought about it. And like by the end of the day, the light bulb went off, and I was like, all right, I get it. Now I understand what's happening there. Right? Like I kind of figured out relativity in my brain. You can't do that with quantum mechanics. You can't, no human can understand quantum mechanics. You could figure out relativity, but quantum mechanics it's basically, you can either know position or velocity, and sometimes things just randomly move. And I had a physicist named Katie Mack on the show. We talked about that a little bit. One of the things, Ricky, I made a short film last year called Cosmic Perspective, and we're actually hoping to get it turned into a TV, like a docu-series kind of thing. And it was how space photography has changed our perspectives on a lot of things. And after I was writing it, we were trying to come up with the story we were going to tell. And then it hit me that what I'm really learning is that through space travel, we used to think of the Earth as two-dimensional. It's flat. You can go left, right, up and down. You can go north, south, east, west. And then once we had airplanes and rockets, we're like, hey, this is a three-dimensional place. And then once we have the Hubble Space Telescope and other things, we've really learned that the universe is a four-dimensional place. Because when you look at those galaxies far away, you're not looking at things that are far away. You're looking at things that are ancient. You're looking back in time when you look at stars and galaxies. And from space, you can sit there, let your eyes adapt, and there are so many stars in the galaxy. I know the basic constellations. I'm not an expert on Earth. I could never pick anything out in space. There's just too many you're just surrounded by these billions of stars that are, and the light that you're seeing is millions of years old in some cases. And it's just, it's pretty profound to be out in space. 99.9% of my time was just work. I had to change this box. I had to fix the plumbing. I had to go exercise. It's just like mundane mechanical work. And then every once in a while you could stop and you could like hear from God. You know, it was like I was seeing creation of something that humans weren't meant to see. And then I had to get back to work to go fix the toilet or whatever I was doing.
And how are the stars, like the density of the stars in the sky that without any light pollution?
Yeah. So you have to turn the lights off inside. You have to make sure there's no lights on outside. You have to make sure the sun is off. So it has to be on the night side of the earth. And then you have to let your eyes adjust. And if you do that, most of the sky is full of stars. But if you look at the center of the galaxy, it's like a cloud. I mean, it really is just, there's more stars than black. Like it's amazing.
Wow.
And we made an IMAX movie called A Beautiful Planet. I helped with that. And there's a beautiful shot this nighttime. We're kind of flying into the center of the Milky Way. It's amazing. There's so many stars out there. It's really awesome. It's very profound.
That's beautiful. And so I have two more things that
okay.
I don't want to take too much of your time, but okay, for now going back to education and general relativity, I just like remember there's this anecdote from Richard Feynman.
Yeah.
Because like from an education perspective, his complaint was that we teach people just to learn things mechanically rather than understanding, and that makes knowledge so fragile. And he used to prove it like asking like math, you know, like what math or brain puzzles or math tricks to different people with things that they already know, but framing it a little bit different. But it's so interesting that he did that with an Einstein assistant. So what he said, and this is maybe a little bit, but what he said is like, okay, imagine that you're in a rocket on Earth, then you go up, right? But and I have a clock or a watch in here on Earth. So the thing is that you have to go up and down and arrive back exactly when my clock marks an hour, that an hour has passed. But you have to follow the exact trajectory of the exact program of speed and height, so that when you come back, your clock actually marks the longest time possible. Okay? Because you know that if you go up, time goes slower.
Right.
You're like, oh, so I'm gonna go very high and then come back in an hour.
Right.
But if you, in order to go very high, you need to go very fast, and then time slows down.
Right.
So you're like, what is the perfect kind of like program that you will devise to come back? And then the assistant went back and he like started like doing all of this math and whatnot. He spent some time, and finally at the end of the day, he came back and he realized that it was a kind of like a trick question, because it's a fundamental thing in general relativity that he should know, that the trajectory is just like free falling. So it's like whatever projectile trajectory you're gonna follow. Like for example, when you're on the International Space Station, and you're following that orbit, the orbit that you're following is exactly the orbit that will give you the longest time possible from point A to point B of all the trajectories that you can imagine.
Right.
So and it's kind of like this type of thing that if we could find some ways in which, like for example, for general relativity that you were explaining, that the universe in a 4-dimensional space is so hard to visualize that.
Yeah.
Especially space-time continuum.
Right.
So hard to visualize. But if you could start by indicating that in the space-time continuum, every object follows the geodesic, which is the shortest distance and longest time.
Right.
Then it may be, at least conceptually, you have it right.
That's an amazing point. I never thought of it that way, but that's really interesting. The movie Interstellar talked about that a little bit.
Oh no, yeah, you know that they had like really great people as like big names in general relativity helping them there, and the techniques that they developed to develop the some of the images there are
visualization.
They are actually used have been used to publish several journals articles. And so the last thing, Terry, before we go, we have to talk about UFOs. And you know what you can do? You can put it in the title so we get more views.
Exactly. That's what gets the views. All right. So here's my take on UFO. And I've done 3 podcasts on those with some of the top UFO guys.
Great podcast. I've watched them all.
Oh, excellent. Okay. So here's my thought. There's a million, billion, 100 billion planets out there. There's lots and lots of planets. So if there's that many planets, you'd think there's life, right? If there's life on Earth, there must be life on a million other planets. You would think that. But I think that life is very complicated. I spent a lot of time doing experiments on my body and medical experiments and biology experiments and stuff in space. And the more I learned is just how incredibly complicated life is, like eyeballs and blood clotting and the sense of balance. And there's so many complicated things. DNA, like how a single cell organism. And so I don't think that life can start completely on its own. I think somebody has to start it. I don't say that from a Christian point of view. I'm a Christian, but I just say that from a scientific point of view. I think somebody has to get it going. So on the one hand, there's lots of planets you think there's life there. On the other hand, I think there has to be some creator somehow involved somehow. I'm not saying that it's just magic poof. I don't think that's what it is, but I think somebody has to be involved. But in either case, those planets are so far away. They're so far away. And the signals that we send out are going to be drowned out by our sun. So the signal to noise ratio isn't good enough for other aliens to hear what we're sending out. So, I don't know. And then you come back to these Tic Tacs and all these videos that we're seeing. Those things are not explainable from what I've seen anyway. Those are kind of crazy things. So I kind of have conflicting views on that.
So I have two questions about that, because, for example, if you see first of all, the problem with all of this is that because of the stigma that it has around it, but the main thing that we need to focus on is not what has been said before or whatnot. It's just the reliable sources. If there's our reliable sources and with kind of like data, that's something that we can get our hands on, that we analyze that. Right. But the problem is like when you start making assumptions from an unknown or false statement, like if I don't know what that object is, then if you say that is from whatever it is, or whatever theory you want to come up that kind of like explains that, then it's going to be as valid as the next one. Okay? Right. So I think that we should focus on the data, and but the main thing, for example, some of these newer data, and I know that there are some reports that are coming from the United States government very soon. But when like the layman look at the radar information, to us may not be as convincing as a picture, as a video, but for you may be more convincing. I've never been flying a plane and looking at something. So when you see that data, does it make more sense to you than like a regular picture? Well,
so I haven't seen the data. I've talked to people who have seen it and know about it. And it sounds really convincing. That's the difference between now and 100 years ago. Now we have actual sensors, visual, infrared, radar that can actually track these things. And when you hear a report, I got abducted from a guy who's in the UFO Society, you can go, okay, that's a guy that's in the UFO Society. But when you hear a report from a Navy fighter pilot, when he woke up in the morning, his goal for the day was to not see a UFO. Like when you're a military officer, you don't want to be the guy reporting UFOs. That's not what you want to do. So there's a lot more credibility there. I think, obviously there, I don't know what actual data is there. I don't know. That's a good question. But thanks to the work of Chris Mellon, those videos were released. And I don't know. Maybe it's some type of drones.
But when you see that, I think you call it before, like tracking data, or when you see like, because to me that radar doesn't mean anything. It could be, honestly. But when you see that video of the radar pilots and people who know, can they relate? Can they? Is it convincing to you?
Well, I did infrared targeting pods for years in the F-16, and so when I see that, it looks like what I used to do in F-16, and there's something weird that's moving really fast. And I've heard them talk about what they have radar tracking data that hasn't been released. Where the thing goes very high speeds, changes altitude and stuff. So that's something that I don't know where it came from. I don't know what it is, but it does sound like there's some compelling data that I'd like to see at some point. I don't know if we will or not, but it's very interesting to say the least.
No, definitely interesting.
Yeah. Well, hey man, this was amazing. Thank you for joining us today and talking about medicine and children's medicine and baseball and UFOs and hurricanes. We covered a lot of stuff, Ricky. That was great.
Oh, it's been great. And I just want to finish to something that I remember. Like we talked about space and we talked about medicine, but there's like an interaction between the two of them.
Yeah.
And especially I encourage everyone here listening to this podcast to stay up to date with the upcoming information that will be coming from the and the results that will be coming from the experiments that they had been doing with Scott and his brother Mark. Because for example, all of the omics that we described, which is kind of like generating a lot of data from the genes, from the RNA, which is the transcript, and for the proteins, and also the metabolism, and different other stuff will be coming up. And they already found something very interesting, which was when we have these things called telomeres at the end of our chromosomes that protect them from, and as we age, those become shorter, and it's associated with different diseases and issues that we see with aging. But for whatever reason, while Scott was in space, those got longer. And so biologically speaking, that's great.
Right.
And then he came back, but then eventually they came down, and I think they're shorter now on average from what they should have been when he left. So this is the type of stuff that we will see in the future with a lot of publications and a lot of new discoveries on how our bodies will react on long space travel. Yeah,
for sure. NASA needs to do a lot more research on DNA. For example, I had skin cancer after both my flights. It was minor, but we really don't do any research before and after how spaceflight affects our DNA because of radiation, because of the weightlessness. On that twin study, they put a lot of effort into the research. So hopefully they'll put some more in for that. But anyway, we'll have to do another podcast about that.
Anytime. You should have me as your sidekick here. I kind of like when you're talking to someone, I'll be Googling stuff and like Joe has.
I need that. Yeah. Like, all right, what's the date on that? You can call up the video of the UFO, which he did when I was on Rogan's podcast. He did that. Yeah.
Thank you very much. It was a pleasure. I really want to thank you publicly for everything that you do for our children. I get like many people asking us like, how can we help and so on. But when you get to the point where you really need to, or I call them, or we need this, we need that, and you realize that you need to sacrifice something, then many of them like go away. Right. But you're one of those that actually are always willing to help. And I remember you carrying all of your books that you brought to our children. And
oh man, that was I was sweating. That was,
God, they're
thanks.
So heavy.
National Geographic, by the way, donated those. So thanks to Nat Geo for doing that. Yeah,
we love those books, and the children love them. So just like thank you for the support, Terry, and I really appreciate your friendship.
All right, thank you, Ricky. And again, if you love Down to Earth with Terry Virts, please give us a rating and subscribe. And we'll see you guys next week.